Every year, around 500,000 sexually transmitted infections are diagnosed in the UK. Chlamydia is the most common.
Most people with chlamydia don't know they have it, but it can cause symptoms as well as more serious health problems such as infertility.
The LUSTRUM programme is funded by the National Institute of Health Research in the UK. The LUSTRUM programme aims to improve the sexual health of people by controlling the spread of sexually transmitted infections.
To control infections, the sex partners of people with an infection need to be contacted quickly for testing and treatment. This is called partner notification and can sometimes be quite difficult to do.
The LUSTRUM team have developed a new way of doing this called Accelerated Partner Therapy, or APT. This makes it quicker and easier for partners to be tested and treated. APT now needs to be trialled in clinics on a larger scale. At the moment, when a person is diagnosed with chlamydia, they are given antibiotics and are asked to tell their recent sex partner or partners to come into the clinic for testing and treatment. What's new with APT is that the health professional asks the person with chlamydia if they would like to give their sex partner or partners a quick call then and there to tell them about the infection. They can also ask the sex partner if he or she would be willing to speak to the health professional to arrange testing and treatment. If the sex partner says yes, the patient leaves the room. The health professional can then do a private telephone consultation with the sex partner and choose if they would like an APT test and treatment pack sent in the post or brought to them in person by the patient.
When the sex partner receives the APT pack, they just follow the instructions to provide a urine or swab sample to test for infections. They can also do a finger prick blood sample for HIV. Then they take the antibiotics in the pack and post the completed test kit back to the clinic. The clinic will contact them when the results are back. That's it, done. The sex partner has spoken to a healthcare professional, been tested and received treatment, all without having to go to a clinic.
16 sexual health clinics in England and Scotland will take part. During the trial, we will measure people who take up the offer of APT and people who don't. We will measure the number of people who still test positive for chlamydia 4 months after treatment, the number of sex partners treated overall, and how long it takes. We will also ask patients, their sex partners, and the clinical staff what they thought about APT. Once the trial is completed, we will use the findings to make partner notification more effective, quicker, and easier.